I'm Dr. Ann Slaughter, and I'm a dentist. Take charge of your oral health. We hope this educational program will answer many of your dental health questions. This program is for everyone, if you have teeth or if you don't have any teeth. You will meet seniors that believe getting pyorrhea or gum disease is just a part of growing old. Maybe you believe this too. You will see seniors that have questions about keeping their teeth and dentures really clean. Maybe you have heart problems or sugar diabetes. This program will also talk about why keeping in good dental health will also help you keep your body healthy. There's a lot to talk about, so let's get started. Let's meet the other members of the team who are going to answer your dental health questions.
Hello, I'm Dr. Carlos and I'm a dentist. Do you come to see me mostly when you're in pain? It doesn't have to be this way. You can help yourself stay in good dental health. I will talk about the benefits of seeing your dentist on a regular basis.
Hello, I'm Trina Sengupta, and I'm a dental student. Learning how to educate my patients is an important part of my dental school training. Seniors, it's never too late for you to also learn to take care of your dental health.
We have a lot to talk about. Let's begin at the Community Senior Center. Today is their Oral Health Promotion Day.
Say, are you guys going to sign up for that bus trip to Atlantic City this week?
How much does it cost?
I don't know that, but they said we have to sign up early.
Signed up early?
Yes,
Hi.
they only have...
My name is Trina, and I'm a dental student. We'll be doing free oral health screenings. Would you like to participate?
And who are you?
Hi, I'm Carlos. I'm a dentist and I'm going to be supervising Trina during the screening process.
Oh, well, I don't need to get my mouth checked. I bought these lower teeth 40 years ago. And every time I had a toothache, I just went to the dentist and told her to pull it. And my uppers are fine, so what do I need to see a dentist for?
My mouth doesn't hurt. I was always told if it doesn't hurt, leave it alone.
Even if you don't have teeth, it's still very important to see a dentist at least once a year for an oral cancer checkup. The early signs of oral cancer are not painful.
Well, I didn't know that. Sign me up on that list, and I'll just tell you two all about it.
I think I'd like to learn something about this oral cancer, and I'd like to be first.
Okay, sign me up too. Add me to the list. I might learn something too.
Yes, you just might. Say, this is very nice, wasn't it? Goodness.
Sir, I'm really glad you decided to participate.
I don't know the last time I've been to a dentist. What is this oral cancer screening all about?
Dentists will look at more than just your teeth.
Oh, yeah? What else are you looking for besides my gums?
We are concerned that everything that goes around your head and neck region. I'll explain and Trina will do the screening. We'll start from looking outside your mouth, your face, your cheeks and neck.
Doctor, what are you looking for?
We're looking for any signs of swellings, lumps or bumps.
Does anything hurt here?
No.
Can you please turn your head, sir? How about here? Anything feel swollen?
No.
Please turn your head the other way. How about here? Does anything hurt here?
No.
Now I'm going to check the insides of your mouth, starting with your lips. Does anything feel sore or tender here?
No.
Let's look at your upper lip. How about here? Anything feel sore or tender?
No.
Insides of your cheeks as well. Anything feel sore or tender here?
No.
Sir, please open your mouth.
Now, could you please stick your tongue out for us? We're going to look at the side of the tongue, and we're also looking for any signs of swelling, lumps, or bumps, any white or red patches that could indicate an early sign of oral cancer. You know, if we catch it early, it's very important.
Please stick your tongue out. We're also checking the surface of your tongue and the floor of your mouth, as well as the roof of your mouth. Please say ah.
Ah. If I had all of this stuff, wouldn't my mouth hurt?
No, these signs are usually not painful. That's why it's very important to get an oral cancer screening at least once a year by your dentist.
Thank you. You've been very informative. Now I know one good reason to go to the dentist if my mouth doesn't hurt. I want to do everything I can to keep on stepping.
Very good.
So what sends you stepping to the dentist? Do you wait until you are in pain? Get an oral cancer screening once a year. The early warning signs are not painful. Don't just give your life away. Catching things early could save your life. We have a lot more to talk about, such as, why do teeth become loose? The plaque bacteria can be a terrible thing. Let's learn how to fight that plaque.
Hello, Mrs. Hicks. How you doing today?
Oh, I'm fine, thank you.
How can I help you?
Well, the main reason for my coming in is that I need to be checked out because this tooth seems to be loose and my gums are hurting.
Wow, let me take a look. Yeah, your gums look a little puffy and red. How long has this been going on?
Well, I have been rinsing with salt water for a while, and that seemed to help in the beginning, but now it doesn't seem to be doing much good.
Yeah, probably the salt water helped you to make and feel better, but it doesn't solve the real problem, because the cause of this problem is plaque bacteria. You have what is called periodontal disease, or what some people call as well pyorrhea.
Well, I know that plaque can cause cavities, but does this plaque have something to do with my having pyorrhea? I mean, I always just assumed that you got pyorrhea when you started getting older. Everybody I know in my family has it and just had their teeth pulled.
Bacteria from food and sweets not completely cleaned can cause plaque.
Plaque is soft and white and will attack all parts of your teeth and underneath the gums. That's why your teeth become loose, is the plaque bacteria.
Well, I always have brushed my teeth. I brush my teeth every day. Why is this happening to me?
Brushing is not enough to remove all the plaque. There's plaque between the teeth and underneath the gums. That's why, besides the brushing, you need also to floss.
Is that the stuff that looks like a string?
Here's a piece of floss. You would wrap it around your fingers like this and really gently go in between your teeth to clear out all of the plaque.
Well, I'd like to floss, but I have a little arthritis in my fingers, and sometimes Arthur just doesn't want to let me do that.
Well, there are a lot of products available that will make flossing easier. For example, this is a proxy brush. This is incredibly helpful if you have spaces in between your teeth. It will use this motion and clear out as much of the plaque in between your teeth as possible. Another product is the Stimudent, which is sort of like a toothpick, except it has a flatter end, and it's a similar motion of a toothpick of going in between the teeth and cleaning out plaque. Another product is floss with a handle, and because you have arthritis, this might be easier. You can also use one with a longer handle that might give you better access back here, and it's a similar motion of going in between the teeth like this. And since you have arthritis, you may not be brushing as thoroughly as you can, and a battery-operated toothbrush might be better. You can find all of these products at a local drugstore or pharmacy where you would normally buy toothbrushes and toothpaste.
Brushing and flossing will help you to keep your teeth clean and your gums very healthy. We also need to see the hygienist at least once a year to remove all the buildup underneath your gums. Do you have any more questions, Mrs. Hicks?
No, I don't think so. This has been very helpful, and I want to thank you for listening to me and educating me. I feel much better about myself and much more confident that I can keep my teeth clean. Now, I want to save my teeth. In fact, I'm going to tell all my family about this. I want them to save their teeth, too.
Perfect.
You can keep your teeth as you grow older. Try out one of the many products that will make cleaning in between your teeth easier for you to do. The plaque bacteria can be a terrible thing, only if you let it. What about those of you who don't have any teeth? Remember, you still need to go to the dentist at least once a year for an oral cancer screening. You visit your medical doctor frequently because you want to keep healthy. You should also visit your dentist at least once a year to help you keep healthy. Let's learn more about how dental health and body health work together.
Oh, good afternoon, Mr. Sanders. Good to have you here. It's been a year since your last checkup. But tell me, how you been doing with your blood pressure?
His blood pressure was great. It was 120/72.
Hi, Doc. I've been doing fine. And I saw my medical doctor last week. I've been flossing every day. I don't want any plaque on my teeth, especially since you told me that plaque in my mouth may make my sugar diabetes worse. I told my medical doctor he should tell all his patients to keep up their dental health.
Oh, thank you for that. We love to work together, Mr. Sanders.
Yeah, Doc, I see it. And keeping my mouth healthy helps to keep my body healthy, and you can count on me. Before I never thought that dental health was so important.
Oh, yes, it is. But I did notice that your denture had a little bit of plaque. Are you using something to remove all the denture paste at night?
Well, I put them in water every night with one of those cleaning tablets.
That's very good, but you also need to brush your denture to be able to remove all the food particles between the teeth. Trina will show you how to brush your denture.
This is a denture brush. It has a longer handle for you to be able to grip more easily. When you're brushing your dentures, make sure the sink is full of water, so in case if it falls out of your hand, then it won't crack. You can also use a towel to line the bottom of your sink to also cushion it. Now let me show you how to brush your denture. Go through all of the plastic and the metal and make sure you cover all of the tooth surfaces and everything else.
Plaque can also stick to your denture. That's why it's so important to keep them clean at night. Do you have any more questions, Mr. Sanders?
Oh, no, thanks, Doctor. I did learn something else today, and I plan to be your patient for a long time. I'll see you next year for my checkup and my oral cancer screening, and I made an appointment with your hygienist for my cleaning.
Very good. Thank you for coming this year, and I will see you next year, Mr. Sanders.
We talked about a lot today. Let's review some of the steps to good oral health and good body health. Have dental checkups and oral cancer screening once a year if you have teeth or if you don't have any teeth. Don't wait until you are in pain to go to the dentist. To keep your teeth really clean, you have to brush your teeth and floss your teeth every day. Make oral health a family affair. We hope that you will pass down what you have learned to the people in your family. There is no reason that your great-grandchildren, grandchildren, and your children cannot have their natural teeth when they get to be your age. You can make the difference in keeping your family's teeth healthy. Take charge of your oral health. You can do it.